Okay, good afternoon, everyone. Thank you, all of you, for being here. And today amidst us, we have Dr. Daniel Machour. Thank you, Dr. Daniel, for being with us today. We are really, really grateful. And so Dr. Daniel Machour, a little bit about him. He's worked for SINA since its foundation, since its very inception as an executive director, which is from 2010. He's a family physician by training. He's done his MED, which is family medicine in Makerere University. Currently, he's a FAMER fellow, and which is a fellowship for health professionals and their higher education, and keeping that going. And also, he's a freelancer at University of Juba, School of Medicine, Department of Community Medicine. So, having said that, I would like to welcome Dr. Machour and start our session today. We are all very looking forward to this session. So yeah, let's get going.
Thank you. Thank you very much.
You're welcome,
for that warm introduction. It's my pleasure to be here today with colleagues, of course, in social work preparation from University of Juba. We'll have to start with the first slides, I think, because we have everything there. But I hope everybody has some sheet.
We need to, sorry.
Yes. Yeah, so before we go to the, stop there, stop. Before we start, want to welcome everybody. It's training today. I understand that we are busy. Sometimes we are busy doing exams, so we have started that. But we try to see how we can catch up to what we're supposed to do today. Few things. I know most of you have been here, so this is not the first time to be in this place, right? Is there any no one? So I will not want to repeat what I have already done by colleagues, but just to remind ourselves, you should be able to know where the washrooms are. Of course, this is the emergency exit. Should anything happen, that's where we get out. And feel free, this is an interactive session. Understand that learning in the afternoon needs to be very interactive. And so we want to engage ourselves. If you feel a bit busy or seeing your friend, it's also dozing, just give a hint so that we can remain lively. For the sake, for my interest, I want to know people. I might not catch all your names, but I think it's important for this training. So what I want us to do as the way we introduce ourselves is just to tell me the name, one name important, like and easier, and then what you do currently at the university, whether you're a lecturer, at which level, professor or assistant lecturer or just a lecturer, or you are an administrator. So those two things would be important for us to know about it. And then we'll pick up from there. My name already you've known, so you can call me Machour. The rest are academic. That's my name. So we can start from here. The first one is going to be on understanding trauma, and the title of the training in trauma informed teaching in social work. As you know, welcome. As you know, the main objective of this training is to awaken ourselves, because this we believe most of you have gone through, but just in case some concepts are new, to be able to give us some basics so that we can be able to go and train the students, the social workers that can be able to deliver social services. So that's why we call it training for trainings, because you already people that are doing this work, but then you're going to cascade it down to students, and then the students will go in the community and provide the services. So we will have two stations. one will run for about 1.5 hours, and that is about understanding trauma. We want to understand the what trauma itself, this concept, and how it affects an individual. So trauma and its impact. And then the second session will be likely practical in terms of us discussing, doing some work together. And that would be on the trauma-informed teaching itself and the strategies you can use as a lecturer, as a teacher, as a social worker in the classroom to be able to help students to cope up with their trauma or experiences that they might have gone. So that's what we're going to cover today. Next slide. So next slide. So that's a slide on disclaimer. So information we're giving here it's from me, it's not from UNICEF, it's not from my organization. That's no. Any information is contradicting, that's important. I'm sure we're all learning together, and so feel free. Next slide. So that's our first session. That is understanding trauma. And this session we are going to understand what trauma is by definition, understand the concept of trauma, and then we will also see the impact that trauma brings in. Next slide. So our learning objectives is to have a shared understanding. At the end of this, we should be able to have a shared understanding of what trauma is. You should be able to identify from here, from this learning, we should be able to identify traumatic events and how they occur. We then should also be able to understand how prevalent traumatic experience could be in real life, in our situations, but also globally. So that's what we're going to see in this first session. Next slide. But then before we delve in, there are a few things to remember, very, very important as we're going to talk about trauma. And just in case you might not grasp everything, I would want us to pick this. Yeah, that's why I start with this slide before we get into the details. And of course, number one, very, very important, the underlying question which we ask with somebody who might have experienced trauma or we suspect to have trauma, the most important question we ask is, what happened to you? What happened to you? In most cases, somebody could be violent, could be aggressive, could be fighting, could be behaving abnormally. But then in most cases, we ask the individual, what's wrong with you? Suppose I come and then just move and people are talking here and then I just come and eat this and then I pretend like I have not done anything. What would you tell me?
I would ask you, what is wrong with you?
Yes, what's wrong with you? With trauma patients or with people who might have experienced trauma, we don't ask what is wrong with you. We're going to understand why we don't ask that. We don't ask what is wrong with you. We ask the question, and that's the most important question we ask. And once you get that, you understand what trauma is, what happened to you. There's a lot of meanings, and we're going to see. The next important thing to remember is the symptoms or the signs that, or the behavior that the person portrays are not actually symptoms, or they are not actually signs, or they are not problems. They are actually adaptations to traumatic events. If somebody comes and bang this table like this, it's caused noise, isn't it? and disruption. And then that's a symptom that somebody is trying to distract you. When a person does that, that symptom which we see, or if what the person feels, that sign which we see or what the person feels, is not a mere symptom. It's not a mere problem. It is an adaptation, an event, a traumatic event. The third thing to remember is that healing for a patient or a person who have experienced trauma happens within relationships. It doesn't happen in institutions, doesn't happen in isolation, doesn't happen when you are admitted. Only it happens in relationships. So if you remember this, then we'll be able to do a good one. Next slide. So what's trauma? What's trauma? Trauma is a concept, and the definition we have here is what it is all about. And this definition is actually a framework. I want us to get this because we're going to expound in the next slide. So we're saying individual trauma, meaning we are talking about the person that has experienced this problem. Results from an event. And you mark those words which have been underlined. Results from an event, series of events, or set of circumstances, okay, that is experienced by an individual. So that event is experienced by an individual. How? Physically or emotionally harmful or life-threatening, and that has adverse effects on individuals' functioning and mental, physical, emotional, social. So, 3 things to note from here. Trauma results from events. Number 2, these events are experienced by an individual as life-threatening or physical or emotional harmful. So that's how they experience these events that are happening. And then this experience has a consequence, adverse consequence, or effects. These effects could be global, meaning they affect the life of the whole person, either emotionally or mentally, physically, spiritually. That's about trauma. That's the definition of trauma. And this thing we are going to look at each of them. So next slide. So the 3 E's we have seen in the definitions. We need to understand the 3 E's we have seen in the definition about trauma. 3 E's in trauma. They are the events, experience, and effects. Now, what are these events? These events or circumstances are the ones that cause trauma. Are we together? We're going to see examples of this, but it is the events or the circumstances that cause the trauma. These are the ones. And then an individual's experience of these events determines whether it is traumatic. Are we together? So what this means is you might experience something or an event different from me. And for you, it would be traumatic. We might be exposed to the same event. For you, it might be traumatic. For me, it's normal. Because we react differently. We respond differently. Then the effects of trauma actually includes those on which we talked about, the adverse physical, adverse social, emotional, or spiritual content. Those are the effects. Now, I already mentioned that these events or circumstances are the ones that cause trauma. This is important because the focus is actually not on the individual. The focus, meaning the focus of trauma is not on the individual. The focus is where? In the environment. What that means is the cause of trauma or the problem that makes this person behave the way he or she is behaving is not about him or herself. Is not his own inherent behavior. He's not born like that. It's not just simply being stubborn. There is an event, there is a circumstance in the environment that has affected this individual and that has made him or her behave the way they behave. What that means is if we're able to understand that the cause of trauma is not the individual, it is the environment or the circumstances the person has gone through, then we'll be able to have the right approaches to handle this individual. Knowing that this individual is not the problem himself, but the environment that this person is in. So that's the focus of trauma-informed approaches. The focus is on the circumstances, the events the person has gone through. It's not the person, him or herself. And as we said, these events may be experienced differently. So it doesn't mean that if this circumstance or event has affected this person this way, the other one will also react to the same event the same way. We will react differently. Next slide. So what are these potential traumatic events? So I'm sure you're following the chronology of the slide. So we are now looking at the events. And examples of these are what you see. They could be from abuse or from loss in life or from stresses. And examples of abuse, and I'm going to engage us shortly, so that we can also add to these examples, could be adverse events of childhood, meaning early in life, a person might have been physically abused, like being beaten or sexually abused, or have seen the death of a loved one or the mother being beaten all the day, or being that early in life from 1 year up to childhood. So if a person has experienced adverse events in childhood, they will actually begin to show early in childhood or later in adulthood. Are we together? Number two example of abuse, of course, is the violence, could be physical, sexual, or emotional. It could be in early in lifehood or even along your lifespan as you grow. Could be immediate, could be long term. Okay, if it's something that happened in early in life, and the person is reminded, these traumatic events can come, and we call that re-traumatization. If the person is made to remember or undergo similar experience they have gone through in life, even if they look better now, they can be traumatized. Some examples could also include witnessing violence. And when I talk about these things, I don't even need to explain, because in this country, there is no location in this country that has not experienced violence. There is no one that has seen or lost a relative. And so abuses are everywhere. But then now let's come to even academic environment where bullying takes place. Could be bullying early in life, primary school, secondary school, and now they're in university. In many places around the world, children would fail exams, or they could even stop going to school just because of it. And just a personal example, I was shocked. In fact, last year I took my younger daughter, very young one, 9 years, to a very nice, I thought I've taken her to a very nice boarding school. And this is a very difficult girl. She finished term 1, she finished term 2 very well. Term 3, when they were about to close, just 1 week to close, some children came and did something. They removed their things They removed their own personal belongings and then they came and put them in the back of my daughter, the suitcase of my daughter. Then they go around, I lost something. This thing is not there. Who has taken my things? Then they call the dorm mother and say, come, we look for this. They come and look, they come and find it in my daughter's back. They did it the second time. And my daughter said, what came into her mind, and we're going to talk about it, this is school. And they did it the third time, and they took her to the head teacher. They bet her. She didn't tell us this, and the mother talks to her every Friday. Talks to her, she didn't want to mention this. When she came home, that was the first thing she said. I'm not really back to that school. Here I pray every day, I do this, but now I am being labeled in the school as the PA. Even I have been taken to the head teacher. They have beaten me 3 times. And these children who come and take their things and they put it, that's an example of it. And now it's hard. That's trauma. For us to convince her, you go back to, she said, if I have to go back, I have not been the boarding school. You know. You see, that's how hard it can be in child life unless you do something. Now, loss could be a death of a loved one, could be abandonment or neglect of a child early in life, or even in adulthood, somebody's been neglected, you're married, it's a family, one is earning well, but then you decide to abandon roles for someone, or the child has been neglected completely, not being supported for one reason or another. Then could be a loss due to war or natural disasters, loss of property, loss of life, loss of job. Could be accidents, okay? Losses from accident. But then you have stresses. Some of these events are not intended. Are we together?
Yeah.
The things we mentioned here, some of them are not intended. But then there can also be intentional causes of trauma. And those are the ones we call stress, like medical causes. Somebody is ill, you've been sick for long, very sick for long, or you contracted a disease that is stigmatizing, like HIV, okay? People taking care of a very sick one or an elderly person in the family, hospitalization for a long time because of chronic illness. And that's what you usually call burnout. They have done everything they could, but then they are strained, the resources are gone, lost job because they cannot go for work. All that can cause trauma, poverty, or hopelessness. Of course, in our situation, that's something we are aware, but then especially if you've been going through this for a very long time, and you see other people are living well, and you're not able to send your children to school, you're not able to pay for your medical bills and so forth. Racism, what we call ethnic issues or historical trauma, people have been isolated or marginalized for a very long time, and then they are not getting services. Family member with substance use disorder. So there's somebody in the family who takes alcohol or takes drugs, this marijuana, and it's causing havoc in the family. These are stressors. They can cause someone in that family to have trauma. Could be your child, could be your brother, could be your mother, somebody who is a patient of substance, is using substance, taking things, is taking drugs, is taking alcohol, all that can cause even a trauma to a person who has been healthy. Next slide. So So that those are events or the causes of trauma. Now we're looking at the second E, which is the experience. Yeah, the experience of trauma is actually affected. So how an individual experience trauma is actually affected by how, when, where, and how often it occurs. Are we together? How you experience a trauma as an individual is affected by how, when, where, and how often it's occurring. And that's why people might be exposed to similar traumatic events, but their response or their experience will be different. Are we together? You could be exposed to this event now, but another person comes after you and exposed to a similar event, but when we respond differently. Why? Because people have different inherent abilities. There are contexts in which trauma occur, where the thing found you, expectations of how you should have helped yourself or how others should have helped you, how you should have been protected. So those expectations, and so you feel different when you are affected, but the other person may be affected differently. So we're going to see how this happened. It has a biological explanation. Next slide. We will see in the brain development how this happens. And so even before we get there, I want us to talk a bit. How can the same events be traumatic for one person and not the other? How? Suppose something happens, of course, God forbid, in this room, and then these doors are locked, power goes off, then come out. Then you hear outside them there's fighting. As here, we can't go. Can't go out. We are locked in, then outside there, there's fighting. We will respond differently. Even here, we will. So why would that event be traumatic for someone and not the other person? Yes, raise your hand.
Yes, because people react differently.
People react differently
From events.
Yes.
Actually, that was the same question that I was actually coming to ask, but since you have already put it.
So now you're looking for answers. Or
I see.
I have an answer.
Yeah, I see about this. People can be obsessed about certain things that are happening. Obsession.
Obsessed about certain things. Okay. Yes.
It depends on the environment you are in, because my environment will not be the same with other environment. So if my environment may affect me, may cause me a trauma.
Current environment.
Yeah, current environment.
Okay.
Will not affect other person.
Okay. Suppose this thing happened when we are all here together.
Yes. According to me, it might be experience. Assume that it is a war happening now. And someone that has gone throughout the war experience might have got the experience.
So previous experience.
Yes. So the new one will be in
Yes.
So
Okay.
the situation.
Yes.
Yes, I was
Yes.
complimenting him.
Oh, your
Adaptation.
People adapted.
Yes,
Okay. Yes.
For me, I thought it's partly with the genetics. Maybe.
Genetics.
Maybe you are mental, you can be a person who can tolerate things, and the other person.
Okay.
Yes.
Coping mechanism for cope differently. Yes.
On my experience, I look like on the background and the history of the other people who have gone many things and have already built resilience.
Yeah.
So somebody who have already built resilience cannot be the same with that person who is just getting this first incident or this incident. So that person who have built resilience, I think, can be a little bit strong to some extent and can at least wait for and see like this is what's there.
Okay. So in other words, you're saying if you might have experienced similar situation in the past, and this thing happens to you, you have
Very
some
much, yeah.
resilience and coping,
Yeah.
Yeah.
and now you know how to cope with this.
Yeah.
So while that is also true, let's compare that with what he was saying.
Yes.
And all of us, of course. So past experience can actually also do what? Re-traumatize.
Yeah,
Yeah.
sure.
But then if
Yeah.
that past experience,
Mhm.
the way you went through it, and then you're able to cope, if it happens again and found you when you are resilient,
Mhm.
then you can also be able to resist this current
Yeah.
exposure.
Yes. One of the things is people have different solutions to the same problem.
Mhm.
On my personal experience, when the 2013 war broke out,
Mhm.
we were in the same house with my sister and my elder brother. My elder sister, my elder brother. My elder sister said, let us go to units because we are just adjacent to units, behind I radio. So to me, I see UNIMIS as if not, it is not the safer place for what? It is not the safety place for our being. Let us remain in the houses until the government will come to know that people are in their houses, and then they will find a way of where we are supposed to go. Indeed, we said until when they say move to these sites where there are safer sites. So people respond to problems in a different manner.
way.
Yeah, in a different way, not in the same way.
Exactly.
Yeah.
Exactly. People respond differently. So we'll see as we look at the brain development. Let's go to the next slide. So we are looking at the third E. That is the effect of trauma. So the effect of trauma on an individual can be conceptualized as the normal response to an abnormal situation. Are we getting it? That person who has trauma believes that he or she is responding normally to an abnormal situation. Okay? Ask the social workers or the people who work in social work system. We should have the same understanding of the person that what they are going through, the effect of trauma on them, it's actually a normal response to an abnormal situation. While they're acting abnormal, like what I said, I come and hit my brother here when we're just talking, or I step on him. I mean, I'm not supposed to do that normally, isn't it? In a normal situation, we have not quarreled and we have not. Why would I hit him? Okay. If I do that, it could be, if I am now a person with trauma, it could be I am remembering the experience I went through. Okay. And then maybe I try to relate the person, how the person looks like, could be looking like him. And when we are moving or he's not looking at me, I'll knock him just to pay attention to me, or to tell him there's something wrong. You see, they act like that. There is a message in their mind. There is something happening in their life which we don't see. And then they act like that, they act aggressively. They are actually trying to express what's happening in them. And then as they do that, for us, we see it's abnormal, but that's a normal way. And we're going to see more slide on similar situations. Effects, there are numerous. Next slide, we're going to see that. So the effect of trauma can cause short and long-term. Trauma can cause short and long-term effects. It affects individual coping mechanisms, coping responses, or ability to engage in relationships, in learning, or even in developmental tasks. It can also have effect on physiological responses. We're going to see some of these: psychological well-being, social relationship, or spiritual believe. So each of this is affected. So when we talk about effect of trauma, it's global. It affects the whole person. And so what this should tell us is when we are planning programs, or when we are doing an academic program, learning for children, or a social work program, it should be for this. Should be listed. Okay, the person could be affected physically, psychologically, emotionally, even spiritually. Their relationships, they are affected because they cannot maintain relationship, and they cannot develop, they cannot learn. We're going to see each of these in details next slides. So when they are affected, they show signs. They show signs of trauma. They could be behavioral, they could be emotional or physical signs or symptoms. They could be psychological. And so you can see the list. Now, when we see this, we remember that person that we know had had trauma. We're able to remember. The list is long. From behavioral, we see that they can easily blow up when you're trying to correct them. This person with trauma cannot be corrected. They get agitated and they argue. They don't want to be corrected. They fight when they are criticized or when they are teased. They resist change. You cannot tell them to change the way they do things, even at workplace. Yeah. They are very protective of personal space, meaning they are suspicious of everything you tell them, and they want to make sure that you don't cross the boundary. And they are reckless in some cases, actually, or trying to be self-destructive. So they have self-destructive behaviors. Others can cut themselves. Those who are very sick, of course, can cut themselves, but they can destroy things. They throw things everywhere. You're able to see that physically, frequently seeking attention. Like they can come to you, create a situation so that you're able to pay attention to their needs, okay? Listen to them, trying to know whether what they are thinking or their suggestions are fine. They would try to consult on everything, seeking attention. They would want to know if what they are doing is right, okay? And they would want to win favor of their loved ones because they don't want also to be looked at as if they are not progressive. Reverting to younger behavior. So they behave childish. Sometimes when they are even adults, they behave childish. You see them enjoying playing with kids and talking things that are not for adults. So those are behaviors. Now, emotional signs or symptoms that they could be having nightmares or sleeping problems, they could be very sensitive to noise. You can't bang at the door and then they don't fight you. They are sensitive to noise or sometimes being touched. Now, if somebody is sensitive to noise or being touched, that will tell you what has happened to this person, isn't it? You want to say something?
But what about insomnia?
Insomnia. Yes, it is there. We said it. We say they have sleeping problems, so they can either be sleepy, they sleep short and wake up, or sleep for a long time, or even sometimes don't sleep.
That is what it's
Sometimes there is no sleep. Sometimes they sleep a lot. Sometimes they wake up and sleep off and on short time.
That is insomnia.
This is insomnia.
Yeah.
It's captured under that nightmare.
Fear of being separated from family, of course. You see, when you see these symptoms, it should point you to the event. Are we together? The event that had happened. And the way they experience, and now it's being portrayed as a symptom. If somebody is having a fear of being and is clinging to a mother every time, clinging to a father every time, you will be able to know that this one was abandoned somehow in childhood.
Yeah.
Okay. And they don't want to be alone. If the family members or relatives or mother, parents are not close to this person, they could even leave whatever they are doing just to their parents. Difficult trusting others. They lose trust. And what will that tell you? Could be this person has been abused by a person they trust most. Could be a parent, could be a teacher, could be a social worker, could be even in the league. Somebody they trust has caused them this trauma. And now they can no longer trust them. Feel very sad, angry, or afraid. Of course, you will know that. So, yeah. And explain medical problems. They are sick. You go, you take them for tests. There is no findings. Everything is normal. They create symptoms. I think I have tuberculosis. And then they are coughing. But when you check it, there is nothing. There's nothing. Yes. Confusing. So psychological, they could be confusing what is safe with what is dangerous. You are sleeping in the same room with this child, adolescent, but you have to leave the lights on. Yes, we are going to look at that. Some of these, as we are going to see, not all of them are traumatic. Are we together? Some of these things we are talking about could be normal situations with some people. Are we together? Not everything we have mentioned here are traumatic events. But even one, just one, a single experience, or a single effect can cause trauma in the life of that person. There could be multiple of them. That single trauma, we call it single episode trauma, but then there are multiple traumas. So a person might have been exposed to several events. They could be having trouble focusing or concentrating, and that's where we come in now as teachers, as social workers. The child is not understanding, they're failing in class because they cannot concentrate. Difficulty imagining the future. They don't know how future looks like. There is hopelessness about themselves. So sometimes this, see why I don't want to mention those big terms, depression, post-traumatic stress disorder, because in trauma-informed care or trauma-informed approaches, we don't mention it. But now when you begin to see a person having hopelessness about themselves, there is no hope. There is no hope with their environment, like the people around them, their family, job, whatever they do, there's no hope. And there is no hope for future. They've lost everything in their minds. Okay? So that could be a sign of depression. Of course, somebody has a trauma. Also, they always expect something bad will happen. All that they know is the whole life is dangerous, and anytime anything bad can happen. They don't remember some periods of their what they have gone through, so you can be able to see that. And all these affect learning. We're going to see later on. Next slide. Yeah, this is where I was talking about. Why do these things happen the way they happen? You are not able to see part of this, but what is up there is the bottom up brain development. Are we together? Bottom up brain development. So what happens with the brain development? There's an arrow which starts from down here pointing. You see, the development of brain starts from the bottom. The bottom of the brain is here. Are we together?
Yes.
Starts from the bottom.
Okay.
And the parts of the brain which are at the bottom, like this, one is there is called brain stem, and then up a little bit you have midbrain. This part of the brain is responsible for simple activities, simple functions, like regulation of blood pressure, temperature regulation, regulation of heart rate, and even arousal states when you wake up and when you sleep. So these ones happen here. Now, very critical point to note is that this brain development, how our brain develops, is actually acquired in relationship or through experience. In other words, for a brain of a person to develop, it's not by any chance. It's an experience you go through. Put differently, if a child is born today, you put this child in a zoo. What will that child be?
It's going to behave like animals.
Be an animal.
Yeah.
Now, the lower part of the brain develops when the baby is actually just born from birth. Are we together?
Yeah.
Brain development from birth, it's precisely nothing. Okay? It's not developed. Even from birth, the brain. But when the baby is born, and you see that interaction between the baby and the mother, that's when these structures begin to develop toward the between the baby and the mother. And you can see when the baby is just born, she will not look at the mother even. But later on, what happens? As the mother keeps interacting, the baby begins to observe the mother and the behavior of the mother. Some of these happen way back in the womb. And then when they are born, they are able to acquire through the experience with the mother. Experience with the mother. Now, as you go up, there is an inner part of the brain called the encephalon. It's responsible for regulation of movement, motor function, okay, affect regulations, how we feel, and then hunger or thirst, so or even sleep. All these are affected by our experience with the caregiver in childhood. Could be a mother, could be another person in the family. So that's why you see a baby begins to crawl but cannot walk, isn't it? And then they can babble but they cannot talk. Later on they can talk. So whoever is a person in the family is the one who is responsible for the development of this part of the brain. If a child must talk, somebody must be able to talk. That's why you can be a Bari or you are a Nuer or a Dinka, but if you decide to teach your child first language Kiswahili, that will be their language, isn't it? Mother tongue, isn't it? Yeah. So, so that's what happened. As you go up, you get now the higher parts of the brain, the limbic system. That's where you get, that's a part which is responsible for now the emotions and the behaviors. So these ones are obtained with experience when we are exposed to family and friends. Family and friends. That's why you get a broken family, the child is also broken. The brain has problem because there's nobody teaching this child.
Yeah.
And what they learn is what they get from outside. They go to friends. You get these children who are on the street. If you open their brains, by any chance, if there is a way we can know. But even when you talk with your children of their age who are now in school, you find a lot of difference.
Yeah.
Because what they've learned is what they've learned from the streets. And of course, the higher one is the cortex, which is responsible for the thinking and the learning and the memory. This one is learned now at adulthood, and that's where we. from peers, from teachers, from the community, and all that. There is something very striking we're going to see. Let's go to the next slide. Related to this. So we're still talking about bottom up. So, but now it's bottom up reaction to fear or response to fear. Based on what we've just described. This is how the brain, the way you're seeing this brain, that's how the brain responds to fear situations or to traumatic experiences, which we said earlier on. These things are called outside there by everybody. They are called problems or problem behavior or troublesome behavior. But we are saying, we're asking, are these truly problems or they are adaptations? Now, one example, and that's something I need you to get well, because we're going to begin applying some of these principles. If a person, they just shoot a bomb or something happens, and you see, I just like using this because this is our environment.
Yeah.
And then somebody comes running because he or she came from there. They've seen somebody shot and then they come running. Because of the brain development we have seen, two things happen to everybody when we are in situations of fear. Number one, the higher functions, the frontal part of the brain here, shuts down. Natural. That is natural adaptation. Are we together?
Yeah.
This one shuts down. And we said this higher one is the one responsible for thinking, for memory, for decision, and everything. So, if you ask this person, what's happening? What's happening? Why are you running? Have you realized that they keep quiet?
Yeah.
They are not talking because they're. Why? Because the brain shuts down automatically so that it will allow this person to focus only on survival strategies, how to get out. Stop thinking, stop memory, stop concentration, find a way of getting out. So the brain stops and they cannot think. They cannot think of what is really happening. Number two, second part of the brain that shuts down is what is called the speech area. It's called broadcast area. That speech center also shuts down. If you ask this person to explain, they cannot speak. You might have heard of what's called speechless terror. Speechless terror, they are not thinking, they are not talking because of what is happening. And that's why these people, they will not tell you immediately. Because now, at that time, the brain is still processing on how to get out. Okay? No talking, no thinking. So in most cases, as social workers, children could be fighting each other, or a child might have done something, or they're running to you, they're being beaten at home. And then I've asked, what's happening? Tell me. And then they are not talking.
Yeah.
They cannot tell. So what do you do? In such situations, you don't tell the person, you don't ask, tell me what happened. Please speak.
You don't force them to
You
talk.
don't force them because their mind.
Yeah,
is
just
shut
give
down.
them time.
So what do you tell them? It's okay.
It's okay.
It's okay. You'll be fine. You'll be all right.
You try to reassure.
You reassure. It's okay. You are safe. You'll be fine.
Yeah.
Yes.
You are
Okay.
strong.
And then you reaffirm it's not your fault. I understand. And then they will calm down. They know now where they are is safe. And then later on they can speak. and they tell you what happened. So that those are adaptations. When people are not able to speak, when people are not able to think, those are adaptations. Those are not problems. Short-term, quick adaptations. Now there are these ones: response to fear, the 3 Fs. Response to fear: fight, flight, and freeze. You know them. In most cases, when a person is being exposed, we label them. And when they are fighting, we label them as what? Non-compliant or combative. People who don't listen and the only thing they know is to fight. Is to fight. Now, in trauma-informed teaching or trauma-informed approaches, that fighting is not a problem. That fighting to that person is actually, should be able to understand that it's actually a struggle to regain. That person is struggling to regain or hold their personal power. Are we together? There's something they seem to be losing, like if they don't fight, they don't get it.
They're trying to overcome the situation.
Yes, so by fighting, they won't demonstrate that they are powerful and their face is protected, and you cannot take that which you want to take. Whether it's an idea, it's an opinion, it's a source or whatever, you can. So if we understand this response in terms of being a coping strategy or an adaptation, we will then be able to know how to respond for these people. So why would this person be fighting every time? Secondly, this person could be labeled as what? Somebody who just ran away from treatment, or this treatment doesn't want to cooperate, they flight, they runs away. This is a person who is trying to adapt by disengaging, by withdrawing from the situation, doesn't want to be part of the problem, so they flight, they take flight, they get off. They don't want to be. Then, and I'm sure you already know in most of the relationships, even between spouses, someone would want to get out. Yeah. Avoid problems, get out. That is a coping strategy for that person. Okay, it's not that this person doesn't want the discussion or the thing to, but they just want to get. And others freeze completely. They freeze, they are labeled as passive or unmotivated. But otherwise, they're actually trying to give in to that one who is in power, and then for them they just keep quiet and whatever you do, and these ones can be abused. Yeah. So that's how we respond to fear or traumatic events. Next slide. So these traumatic events can actually be increased. The impact can be increased by some of these factors, and these are very important. One, if the event occurred early in life, like we said, and we're going to do some exercise after here. If the event occurred early in life, the likelihood of the impact will be very high on this person. If the event happened early in life. If the event happened early in life, and now you're exposed again to similar events, then the likelihood of the impact being greater will be very high. Are we together? Number two, if a person who has experienced trauma, it's actually being blamed or being humiliated for why they are behaving the way they are behaving, the impact will be more. Are we getting it? Number three, if they are being silent or they are not being believed, you don't trust what they are saying, and you just shut up. It's nonsense. You don't believe what they are saying. I don't want to get into difficult scenarios telling what this, but somebody will tell you, you see, Last week I have been appointed the vice president. Now I'm invited, sworn in, and then they begin to dress nicely, want food, and if you don't eat all they want, they fight you. You are the one who want to block me and all this. When you don't believe what they are saying, the impact of that trauma is actually. What does it mean to believe what they are saying, even when it is nonsense? What does it mean? It simply means to affirm. Say, okay, fine, I understand. So you engage in discussion with this person, and that's how psychologists and even psychiatrists are able to approach care for this patients with mental health problems, because you don't argue with them, because those beliefs are strongly held, and you cannot tell them that it is not true. Somebody will tell you, my stomach, I have stones, and they can see like this cable passing. This is for them, it's a snake. It's a snake ready to bite. Now, the only thing, it's okay, fine. So you ask, so what do we do? Say, oh, there's nothing. Oh, it's not harmful. It's a snake, but I think this type is not so harmful. Can just stay around it. And as you engage this person inside discussion, the mind gets into something else. But then what we are trying to say is, if this person is having trauma, and the parent or whoever is with them, the caregiver, doesn't believe what they have gone through, a real experience. Sometimes people think they're just pretending, or they're trying to seek attention. The impact becomes great. And more worse is if the perpetrator is a trusted caregiver. If the one that caused the trauma is either a mother, father, a relative in the family, a teacher, a social worker, a humanitarian worker, the trusted person that they cannot go and talk about their name, because this child cannot report anybody who's been abused by a father or by a teacher. They cannot tell you that it's the teacher who raped me or the one who is. The impact is great. And this one is also, this type of trauma is called betrayal, because the victim feels betrayed by the one who is so trusted. Once the event comes from a trusted person, the society, the impact from that person. That's the point we're trying to talk about. Next slide. So adverse childhood experiences actually can affect us. So we're coming to some exercise shortly. Adverse childhood experiences can affect a person's health in adulthood. We together. Meaning, if you have had an experience in life, whether you remember it or you don't remember it, it can affect your health when you become an adult. What we are talking about here, this adverse childhood experience can be very serious and can have adverse consequences. It can cause, number one, adoption of health risky behaviors as coping mechanisms. Meaning you can see somebody having some eating disorders. They want to eat quickly. Food is hot, but they want to eat now, and then they will not even finish it. Okay? Or pick everything and eat and throwing. Okay, it's an experience that happened in childhood. Now in adulthood they able to see. So that's a risky behavior. You not know why this person was eating like that, but it's showing in adulthood. Smoking, and abuse, self-harm, or even sexual promiscuity because of what they've gone through in childhood. they could be experiencing severe medical conditions such as heart disease, pulmonary disease, or even liver disease, sexual transmitted disease, or gynecological problems like cancer and because either they have been abused sexually or they have been on the streets and so they are abused, or in childhood their development which we talked about, like for the heart and for the lungs, it's not so mature because they've been abandoned very early in life. In adulthood, problems. They die and they die. Next slide. We'll look at this and then we'll do some exercise. So a study has been done in 1995, 1997 in California. And this study was done to assess how traumatic experiences in childhood can influence your health and well-being throughout your lifespan. From conception, from when the mother becomes pregnant up to the time you die. So it's been found from this pyramid, it's been found that adverse childhood experiences, okay, can result to disrupted neurodevelopment, meaning central nervous system, autonomic nervous system will not develop properly. There will be dysfunction, disruption in the brain, in the nervous system development. When you experience a traumatic event early in life. That's the first stage. The second stage is there would be social, emotional, and cognitive impairment, meaning the development of your social spheres, like how you relate with people, how you talk with people throughout life, how you react emotionally, how you feel when you are with other people or when you are alone, and then brain development, thinking, concentration, learning, memory, all that will be impaired. It will be slowed down. Then, as you go up now in life, as you go up, there will be adoption. This person will adopt health risky behavior. The ones we have seen, smoking, those eating, sleeping outside, being sexually immoral, doing everything, drinking, using drugs, all that. Anything they find on their way is what this person. As you develop, and then early in life, you will also begin to have diseases that are chronic, that is some disabilities, social problems in society. Now you begin to one of a gang member, you're beaten, you are police, you have a problem with everybody, and then you die. So this is what happened when you are exposed early in life. From now, a study was done, and a report was shared in 1998. It was found that a male child with adverse childhood experience who has a score, and we're going to do that shortly, a score of 6 out of 10. There are questions that have been framed to check how you've been exposed to trauma in childhood. So it's found that any male child who has a score of 6 out of 10 has 4,600% increase in likelihood of becoming an IV, that is intravenous drug user later in life, when compared to a male child who has a 0 score. What we are saying is, these questions, you have them here. And I want to put a disclaimer. I don't know how we live our life, including myself, but these questions are very sensitive. Anyone might feel anything, memories about what you might have gone through in life. So please, if you feel like that, as we're going to look at these questions and you want some help, let us know. We have friends here, we have social workers. This environment is safe. but I want to trust that we will be fine with this. So we are going to read these questions, okay? And when after reading these questions, I want, you are not going to speak to us, but I want you to take note. Take note, just circle it somewhere, and you are going to take this document. Circle it somewhere. One or two, or how many of those scores applied to you in childhood. Are we together? That's going to help us, you and all of us, as we're going to continue in this church. Okay? So take a few minutes. Maybe I'll be reading aloud as we think through there another copy.
There are some excess sheets. This is for later.
Those ones later. Yeah.
Oh, no, so,
Circle the numbers.
Yeah.
Yes,
Circle
but
number.
for you, you're
For yourself,
you'll-
what you have
maybe you all can do
experienced.
it privately.
yeah,
It's
private.
very
You don't
sensitive,
know-
yeah, you know. So yeah, you don't have to work as a.
You don't have to.
Yeah. It's confidential, exactly.
Yeah.
That's right.
Keep it to yourself. It's just for you to make a note. I know even when somebody has more scores from this, there's something we mentioned, isn't it? Copying studies. You might have copied things. And so really good living your life. Yeah. But don't forget that these experiences that we have in life, sometimes if you are exposed to a similar experience and you don't have the coping strategy, the coping mechanism, the environment, the safe environment, then it can be re-traumatizing. It can bring back that. So especially if we're able to remember exactly how the event. Okay, so quickly we will continue. We'll break soon for a second. Yes, next slide. We'll break soon. So we are trying to look at trauma prevalence in children. After having seen how adverse childhood experience can cause the life of a person throughout lifespan, these statistics are alarming, but they may not apply to our situation, all of them. But it has been found that 71% of children who are exposed to violence, okay? Actually, 75% of children are exposed to violence every year. These are statistics, studies from US. But now if you compare the rate of violence in US and South Sudan, which one is more worse?
Yeah.
US.
South Sudan.
US.
US is what?
Compared to South Sudan?
Somebody saying
South Sudan.
South Sudan.
South Sudan.
This is 2013 study. So if there are 71% children who are exposed to violence every year, means that all the children, actually, almost all the children are experiencing violence. They're also saying 3 million of children are maltreated or neglected every year. 3 million. They are maltreated or neglected. How many children are now on the street this year compared to last year and compared to the other year? So it seems every year problems of children are increasing. Drone crows, like some years ago, it wasn't a problem, but now it's becoming too much in this country. 3.5 to 10 million children witness violence against their mothers every year. Violence again, and that's traumatic. I'm sure you saw such a question in the questionnaire. Violence against the mother when the child is sick can be very traumatizing. 1 in 4 girls and 1 in 6 girls,
1 in 6 boys,
and 6 boys who are actually sexually abused before adulthood. This one's also coming, isn't it?
Yeah,
Yeah,
it's
this
correct.
young boy is going after.
Before adulthood.
Yeah.
And 90%, 94% of children who are in juvenile justice, who are arrested and
Our
in the
prison
prison,
is full.
have experienced trauma. Meaning, when these children are in the prison, what took them there is actually
It's a trauma.
whether they have stolen or they have done what
Kill.
took them there's trauma in it.
Because also in the prison, when they take them there are people there who are criminals. They're
Yes.
all kept in one place.
Yeah, it's also
This is
re-traumatizing.
another thing. Yeah.
Re-traumatizing.
Mm.
Next, so that's how prevalence it could be, and we could relate. The reason I brought this slide
But
because
in
I
just
set
in
context.
juvenile justice,
Yeah,
we don't intend that they are going to be traumatized again.
yeah.
That is not a consistent. This is not a concern, but the real concern is to reform them, to transform them. That's it.
This is what's supposed
Yes,
to be.
but what she said.
What she says is right.
The other people,
The other
get
folk
there,
inside,
Criminals are
yeah.
there.
they begin to tell them stories and so
Smoking, they learn smoking. Some come there with
Even they add
smoking.
more.
sneak in.
They gain more insight.
Yeah.
Next
They
slide.
gain more insight.
So we are saying also 40 to 80% of school-age children experience bullying at some point during their school time, during their school careers. Meaning,
That's
not only
serious.
that time, but throughout their careers.
Yeah.
Bullying.
But by the way, actually in South Sudan, I don't see whether it's common.
Bullying.
Yes, bullying is not common in South Sudan.
So
Go
why,
to Kenya.
that somebody can also
Boys.
do a study on that.
Yes.
Yes.
No, it's not common here. Let me assure you, it's not common here. If you go to Kenya, you go to Uganda, you will see what is bullying.
South Sudan.
South Sudan, they don't know all this. Yeah,
Are very aggressive.
But it is there, isn't it?
it is there anyway. Compared to other country, it's very low.
You arrive in a school today,
Yeah,
you're a new person, and then they begin, okay,
They
welcome,
start
come.
stealing your food
It's like
in the
they
morning.
welcome you, but when you open your things, they
They
start
steal. Children
disappearing.
Yeah, I saw for my daughter the first time she went to boarding, my daughter faced.
we're
all
here
the
in South Sudan or Ma, that's why we say it's here. That's why we say in Uganda, Kenya is common. But here in South Sudan, it's not there.
That we need to know why is it low?
Yes.
Our children want to house to school. They have very soon.
So
Even boarding is there
boarding school.
Which one? You know, it become a culture it become a culture throughout. You know, once you are the first group, you experience the same thing. It's acquired now. When others are coming, you have to make sort of revenge. You give them the same system or give them the same way you receive them. They look at it the way they receive. It is a sort of receiving.
Some children also, when they go to boarding, they come there, they know even the tricks of stealing now.
Yeah, why not?
I know from some of my young cousins.
Yes.
There's a point that I need you to this give me some explanation. Based on our experience as lecturers, because we have students, and the situation that we are in now, giving them examinations. You find, of course, in South Sudan, students like it. And this student, if you maybe get that person cheating or caught cheating, of course, he gets now, that person gets traumatized. Of course, that person will not feel now comfortable in terms of even answering the question. Like even this happened when we were giving examination specifically to me in the morning. Got one meeting, the person even refused not to work on the question. Now in such a situation, how will you tackle that? No, if you don't feel the situation, that is what I'm saying. You are causing more trauma on this person.
Yeah.
That's a very good question. We have in the second session where we are going to talk about classroom strategies for teachers to handle students so that they can cope well. One of that is what we call positive discipline. Positive discipline. This student needs to be disciplined, but positive so that it will not cause more harm to the student. It's not a good practice. It should be punished, but it should be done in a positive way. The question is, how do you
not cause destruction?
You don't yell at the student so that others will know he's the one cheating, because that is traumatizing. Actually, much more than you, the teacher, spotting on that student. Once, you are the one you're cheating. Oh, and then you begin to grab the paper. Then everybody looks around and then they know, oh, you're the one who has been cheating. For the rest of the academic, for that student, he will be the worst, or she will be the bad person in class. Because everybody will know he's in the one cheating. So you don't expose. If you notice, you go slowly. That student say, I need to talk to you. Then the rest will not know what is happening. Okay? The student see what then and then you know what you do. You take note. You can put a mark even on that paper. Okay, then you allow the paper. Yes. All right. I might not be very good. I'm not yet there, but that's what I'm thinking from my informed approach. Yes.
Because we are always on ground. We are there. Now, if you leave the chance for them to talk to them slowly.
Positive response.
Because they yell at you, and if you leave that space, even you get yourself
the students intimidate you.
Yes. Like me, even in the morning, I was told, who are you? You keep silent. Until now, the other students have to say, hey, you, be silent. I'm not supposed to speak like that.
Okay.
Don't touch me on that.
So you must speak.
You have to speak.
Yeah, that approach. I
So
have experience also.
Let's hear. Yes.
Look, I have the same experience. I try all the strategies, okay? I approach them and try to explain, this is warning, don't do it again, okay? Yes, I've seen you with some foreign material, so don't try it again. They said, where is it? Can you show me where it is? And it is inside, okay? So they denied. Later on, it's happened to court the student with the foreign material and try to say, no, what is the way out? I have to give you cheating case because I want you and you protest like you have not done anything. You see, such cases are there. When you tell them secretly that you are doing something against the rules and regulation of examination, they protest. But there is nothing like that. You are accusing me for nothing. Where is it? Can you show me? Okay? Those such cases happening. Yeah.
Yes. Very impressive.
A student, I caught her with a fake note. On how close this open put in someone. When I found her, they stick the paper and start eating and swallow the paper.
Yeah.
I like to do at this. What can I do now?
Swallow the paper. So let's hear from So it seems this is not rampant and we don't have solutions.
Yeah, we need to be.
Yes.
Why don't we have a solution, but we are lecturers?
Madam, that one even I cannot watch.
Yeah, put
Right.
this.
But there was another one, she came with the damage. She put inside the damage.
Damage is a trouser.
That trouser, that is called damage. Yeah. She put it there. Then when I called, I said, you bring it. She doesn't. She went and put in the panties. I said, I will put my hands inside your panties. This is when she started giving me the paper. Now you see.
So now when we are saying that, are they rest hearing?
Yeah, the the situation of the
Okay, we will continue the discussion. Let's hear from Toby.
Yes.
Then we can discuss later. Huh?
Thank you very much.
Huh?
I think this is very interesting topic. This is a multi-practice exercise by some of the students, not all of them, but the issue here depends on the lecturer's behavior. When you get somebody cheating, then you should not harass the student. Yeah, you need to behave as a lecturer. You just ask the student to hand it to you. After handing, then don't prevent the student to continue with the exams. You say you just continue. This will be addressed. Don't even write. Say, put a mark. Don't put for student a mark. You just take the documents. The student has a ID card. You take those ones. You take the note of it and return them to the student. That one will create a comfort on the student himself and will continue to do the exams. Then after that one, there will be later investigation done. Yeah, to penalize the students so that the same mistake is not repeated.
These university exams or national exams?
This is university exam. I think, yeah.
It's a university exams. So if you approach the student in wrong manner, the student is likely to defend himself.
Yeah, identify.
Yeah.
Correct. Yes. Yeah, that's a very good point. Right. So this statistic will continue to talk about the next slide.
Yeah.
We'll continue to, but these things are very common. In adults now who are in mental health, I'm bringing this because most of us are social workers, and so we work in this country. There is no mental health hospital, but we have a lot of women girlfriend spaces, child-friendly spaces, where some of you or even you working there. In mental health institutions, we found in adults now, not children, it's been found that more than 80% of adults with mental health problems have actual history. They have histories of problems. Number two, 50% of female and 20% of male that are in those accessing those mental health services have actually experienced sexual assault in adults. Okay. Also been found that clients or mental health patients with histories of childhood abuse have numerous problems. They have earlier first admissions in the hospital or have more frequent or longer hospital stays. So these are the things you find about them when they are in admitted. 65% of those patients actually use substances. So actually use substance, and 12% of women that are actually being treated for substance use have previously reported this. So these are statistics that can apply even in settings. Next slide.
I just want to say, the last part, can you take the slide there?
75%.
Women, there is something that happened that there is a Congolese woman there, I don't know that she's the one there are women who use this to carry some of those drugs that are being used these boys. So this is something that is happening now. They use women.
Yeah.
This
because
is what
they cannot be suspected.
Yeah. This is what is recently happening now in
those are illicit businesses. They could be using the substance or they are not using, they're just doing it as business, selling to earn income. But of course, that happened. It could also be because sometimes, yeah, sure. So we're going to discuss this question, and that is the end of the first session. We'll break after here, but before we break, what makes something traumatic? Just to recall all what we've been discussing. What makes something traumatic?
according to my own understanding, something that makes someone to be traumatic is an event that has a violence is happening you, whether it is physically or not physically. Like just a very simple example, you lost a colleague who passed away, and that person has been so nice and so good to you. You really have sweet and beautiful times together. And such an event sometimes it will disturb you. Sometimes you are somewhere, you are not having good fun, you just flash back to that. These are some of the things. Yeah.
So that's a good one. You said an event. An event that has happened, maybe a loss of a very close friend that has affected you, overwhelmed you. Yeah. What makes it traumatic? What makes an event traumatic?
Sometimes maybe in case of raping, if a woman is raped, that case that he banned may send her to get her to be traumatized, or she might be feeling that is humiliating. Sometimes when she thinks of herself, looking at the friends, those who usually work with her, and she has already having that kind of event, that may even make that kind of something of what we call rapping will be a traumatic kind of thing to her.
So yeah, that's an experience. If you were able to remember. So it's about events. So it's those things which we mentioned, huh?
It's about it.
It's those three E's. Are we together?
Yeah.
It's the events,
Experience and the
experience, how you experience that event. Remember, people experience this differently. And then the effects. How often it occurs, where it occurs, and how you've been affected with it to make that situation traumatic. So yes.
How about one being exposed to that situation? Will it not cause more?
If you are exposed again, yes, of course, re-traumatization. So if you are exposed, even and I did mention this by the way, if you have had an event in the past and you begin to think about it, or you see it, or somebody talked about it, it can bring back trauma. So that's why even when we are handling students or social workers or whoever dealing with our children, we need to be aware. And of course, time is not enough, but then I wanted to give us tools which you can use to quickly screen for trauma. So that you'll be able to know in this class or in this center, the ones I'm dealing, who among these would be undergoing trauma. Then you will know how to talk and how to handle. Because when you begin to mention some of these things, they can bring those memories. Like what we did, flashback. What we did today, it can affect some. Of course. Yeah. Can affect some. Yeah. Yeah. So yeah, we're actually talking, and then after here we have 1 more minute to close this session. Then we will break for 15 minutes or 10, 15 minutes. Then we'll come back. Yes.
Just to know something that was mentioned by some of the colleagues about if something happens repeatedly to someone, that thing that happened again to you makes you now, when it comes again, makes you a bit stronger in coping or dealing with it or not. I need to know. This is one. Then the other question, I need difference, or if there is a similarity when a parent is disciplining a child.
Children.
Yeah. For example, we as Africans, disciplining and then trauma. So I need to know when we talk about discipline, what do we mean?
I want actually to start with the last one. You see, as much as we mention all those behaviors, bad behaviors, it doesn't mean all of them are actually pointing to God. I will be there. But then you can find there are actually true bad behaviors and behaviors that are traumatic. So when you look at this as a parent, then you will be able to know if you have been the one staying with this child. Is this child just big-headed? Is that just being stubborn, or that is trauma? You should be able to know. And so when you are disciplining, you should be able to discipline positively. Children will know the kind of discipline you give them, whether it's a bad discipline or a positive discipline. They will know. How you are beating them, they know. They know. And of course, anger, when it comes, it comes. You can be able to discipline your child. Then as a parent, it should be very positive. Discipline this child, but don't deny this child the rights. Yeah? Okay? You should be the same person to comfort this child. Mothers know it very well. They can discipline a child and still comfort the child. So, but then you should not be able to differentiate between your children in the way you discipline them, because then that would be traumatizing. This child is being beaten always, or is being harassed, or is being sent, or being given hard labor, or being done this, or being named names, or being belittled, or so forth. Once you do that as a parent, that is traumatizing. And if children begin to know this one is favored, this one is not favored, and they live with that, they will know, yeah, me, I am not loved. I am not loved, and so on and so on. Last one.
I just wanted to say that if the punishment or by discipline, if the discipline is going to be by beating the child, then that one increase more trauma. Child, and that child may even go up for very stubborn. So beating, I think, is not a solution.
Also,
One of my neighbor was beating her child, and then I went to intervene, and she told me that, you know, we are in Africa. In Africa, if we don't beat, these children will grow up thieves. Either they become niggers. So you have to beat them so that they refrain from what they are doing. I told her, no, this is not true. Yeah, in the modern world, we may even take you to the police, then you will be imprisoned for this.
So I leave that to
Once
us as parents.
they resist sometime,
I leave that to us how we discipline our children.
Again.
Depends
It
on,
depends, yeah.
depends on an individual. But the most important thing, it should be out of love. It should not be punishment and showing hatred.
There are positive ones, positive punishment.
Positive. It should be out of love. The child needs to appreciate at the end of the day why you discipline them. We together. So let's break for we have tea, we have water, you can refresh it if you can. It's what you want. Then we come back in 10 minutes to finish the last session. This one would be doing a lot of work, so be very interactive. So welcome back to our second session. Thank you very much for very active participation in the last session. That was the longest, but you were a very active class. I like that. This one is going to be more interactive. So I'm sure you will go home. So our learning objectives, and of course what we are looking at there, you're not able to see the clinic. Because of the but what you have there is trauma-informed teaching and coping strategies for students. Okay? Trauma-informed teaching for teachers. Okay? So how would you be trauma-informed, meaning every teaching or administrative work you do with colleagues at workplace or with students as a lecturer, how you do that in your communication, in your meetings, in your decision making, in punishment, all that needs to be trauma informed. So how would you do that? What activities we need from you? And then the coping strategy, classroom based coping strategies you can be able to apply as a lecturer, as a teacher, to be able to help students to cope with their trauma. And so we'll be looking on how trauma interferes with learning, the classroom strategies that reflect trauma-informed teaching for teachers, and classroom-based learning activities to explore trauma and involvement of students in learning. Next slide. So how trauma interferes with learning. A lot of these we already discussed, the effects of trauma. We've seen all the aspects of trauma. I mean, how the trauma affects all aspects of the individual life, physical, emotional, psychological, and even socially and And now we also saw that trauma has effects in the brain, cognitive effects in the brain, how the brain functions, about concentration. When we talk about cognitive functioning of the brain, it's about concentration, attention, like now we are talking, isn't it? Whether you are whether you're following what I am saying, the chronology, how you are getting this presentation in your mind, your attention, your concentration, your thinking, and also memory, reflection, decision making. So those are cognitive functions. There are immediate effects. Okay, how trauma affects learning in immediate terms, but also in long term. So immediate cognitive reactions, delayed cognitive reactions. These ones, they affect learning in short term, immediately, or even later in life. So one is difficulty concentrating. Okay, difficulty concentrating, meaning you lose track in following whatever is being said, or even by a parent or by a social worker. You're not able to follow. And we're going to demonstrate a few things shortly to see whether we'll be concentrating. Rumination or racing thoughts. You think about this in your mind, and that's how trauma affects people. While you are talking as a teacher or even as a social worker, this person is thinking about this, but something else come in and is not able to relay the thoughts, what he has been thinking with the other one, and then they are racing in the mind. Distortion of time and space. A student who is affected by trauma or a child who has trauma would not want to, would feel that every time the room must be lit, there is no darkness. Okay, and they would think that if it is dark, it is night. It should be lit so that it remains day. So there's distortion in their minds, and they want to correct things, and so time of the day, even weeks, the month, whatever, they will not be able to know in immediate terms. Memory problems, they will not be able to have good short-term memory, but even long-term memory. Like they cannot remember what happened in last week, what happened last month, but even what happened yesterday, they cannot be able to remember. So you can see it will be very hard to teach such students, such children. Strong identification with victims. So the people that they want to associate with are those that have experienced it, because it seems they behave the same way, they understand each other, they're able to show that they are the ones who care. But in most cases, they want to be there because sometimes they feel that's where they are hurt, that's where they are accepted, that's where they are, because they understand each other. If you go to to psychiatric hospital. I don't know whether you have gone, but I went to Tabika in Uganda. You see, those patients who are admitted there, they care for one another. They like themselves.
They sharing experience.
Yes.
Because
And they help each other to cope. They even, those who have managed to cope, they are able to help the others because they really understand each other. So the delayed cognitive reaction effects of trauma in learning how this affects a child or a student will have inclusive internal memories or flashbacks, things we're talking about. So even if you are teaching something here, but there's something that makes them remember, and then their mind is all taken there. You're in the class, but they are not concentrating because the memories have come. That's why our speech, our communication needs to be trauma-informed. Reactivation of previous traumatic events come into their minds, and then they will not be able to, they will not concentrate. They blame themselves for what they are going through in most cases, and so that affects their association, their relationship with other preoccupation with events. So you find that they are doing over and over again something, and that situation where they have been exposed, they would want, it's what they are thinking in their mind. Their mind is preoccupied about it, and that's what overwhelms them. Difficulty making decisions. They cannot decide for themselves. In most cases, they need help, they need attention. Magical thinking, like some of the things I was talking about. We call them magical, but in medical terms, they have a lot of delusion, hallucination. Okay, they tell you they think something which are unimaginable. Someone can say after seeing an insect flying, that is an aeroplane. Believe that feelings or memories are dangerous. Okay, they believe that what they are feeling and all the things they remember is actually affecting their life. Which could be true because traumatic events, the way they affect an individual is that it's overwhelming, it's life-threatening. Inside them there, actually they are suffering. And there are a lot of things they do. In most cases, you see somebody they can pick things and put into their ears because there are things there are things they are hearing, don't hear, that are actually traumatizing, and they don't want to hear these things. They don't want to hear this. There are sounds, there are voices, there are things talking to them that they are not hearing. But them, they are hearing. And so those could be traumatizing. But those are also beliefs. Like somebody could be having a stomach pain, physical stomach pain. They had something is happening in the stomach. And they will tell you, I cannot eat food now because I have stones in the stomach. It's the way they are feeling it. It's the way they are feeling it. So, as we said, some of these expressions and the way they behave are actually adaptation. Whatever they express has a meaning. So it's a role of social worker, psychologist, or even a medic to be able to interpret what that means. It could be a false belief. It could be a situation that has an inference, something you can be able to use out of what they are going through and be able to find out why they're doing that. You'll find somebody who would be tying, they can tie a leg, they can just tie something good, or come and cover their face, tie something here, and then they move, not seeing, but they've covered their face with a piece of cloth. There's something they don't want to see, but there's something they're expressing. They could be having a pain, and then they tie this leg, and then they are moving, tying a cloth, then they just move it. These are expressions that they are doing something. Suicidal thoughts can come into their mind. So all that, when a person has a student or a child learning becomes difficult. Learning becomes difficult. Concentration, thinking, memory, decision making, association with the rest of the colleagues is affected. It's affected. Next slide. We are soon going into a class. Those of you who are feeling a bit tired, we are soon going into an interactive session. So low reading achievement. They will not be able to read enough. And you know, as a student, you must cover the syllabus. You are preparing for exams. They can just read a page and then they are tired. You see, mental fatigue, emotional fatigue. They are tired emotionally. They are tired psychologically. They can't finish a page. Given or trying to solve the number is hard. They cannot finish reading, so they cannot achieve what they're supposed to do. Poor concentration in the class, even when they are discussing with the group, nothing. They will not pick anything. You are talking, you repeat it after them, they will not even repeat it. And they struggle with motivation, of course, concentration, focus, and they are not able to do that because of the impact of the phone. So all that globally affects learning, okay? Whether in the class or even as children in the center where you're providing services. And next.
Before you do that, I have a question here.
Yes.
I need to understand something here. There are individuals that sometimes we see that are not going, actually they are affected, they are traumatized. And some of them are maybe students. And you'll find that some of them, sometimes they are the one even paying themselves, and others, they may be having colleagues that are paid by the parents, maybe up to university, but some students you find they do extra work, and then if you ask them, they'll say, I went to my uncle maybe to ask something for school fees, but the uncle refused, so I have to do security job and do this, with all this. You'll find at the end of the day, some of these students, they have very good results. So I need to know really, the student, how are the students able to do that? Some others that are actually being provided with everything, you'll find even some of them don't get good marks.
Doing better.
Yeah, they're not doing better.
We know what people call a spoiled child. But a child also who learns through experience. You see, when a student or a child accept the situation of the family and then walk through to be able to support it, so they are co-positive. It means that hustling they are doing for them, they are taking it positive and they continue to work. It doesn't mean going through financial hardships can be traumatic for everybody. It can be traumatic for somebody because you have been enjoying in the past, but now it will change. It will show in low performance in the class, low performance, lower performance, or even scolding lectures for class.
Also, this security work,
But
like the whole night there is
they are reading.
They read.
It's at least comfortable. It is better than working in a factory or where.
By the way, we have these two things which are different. We have learning disability and trauma are great difference. Learning disability is a different topic, but this is the trauma, which may happen sometime, even if the child was very clever before. And if he gone through traumatization at the process, which means the child will experience the low reading achievement, poor concentration. That may happen shortly because of the condition that child have actually entered into it. So
that's a very good point, Larry, you brought up. There's really a difference between the mental development, cognitive development, or behavioral development and childhood. Could be, somebody was talking about genetic. Could be having a child, could be having developmental problems, either problems from birth or even during pregnancy, and there will be developmental delays. So that's mental disability. So mental disability, definitely learning will be affected. But we are talking here about a situation where there's no mental problem affected, then there's an evidence of history, I mean, of exposure from when that affects the child. So that's what happens with learning. So poor performance in school, failures, repeating classes, all that is coming because of poor concentration. You cannot read, you cannot remember. Next slide. That should be, yes.
Also, they say nutrition and children get affected. And they are managed left well.
Yes.
So what is the link?
That is correct. People say
it's also the
we are what we eat, isn't it?
Yeah, it's also a part of trauma. If you don't eat, you may get trauma.
Malnutrition.
Yes. If you don't eat,
being
overeat, when are you going to get food? So you cannot concentrate. It's part of the lack of food.
Yeah, but malnutrition goes back to the same thing she was talking about. You don't eat well, brain development will be weak, and then learning will be affected. But of course, not having food can cause trauma. Sleeping without food today, then tomorrow, and then your neighbor is enjoying the smell of things. It's not good.
It's not good. Because trauma.
You need to think about it.
Wait.
That's what we talked about, poverty. Comes with all that arrange. Yes?
One of the factors that affect learning.
That somebody being exposed to acute or a kind of chronic or complex trauma. And how will you handle this? Because this stereotype, I think, need different approach.
Yeah, that's a very good question. We say it, if you are exposed to a single event and it happens within a short time, that we call it acute episode or acute trauma. Others might have been exposed in the past, they have lived through it, but still they are not out of it. Others have been exposed to an event in the past, they have come over it, they have coped, they are out of it, but if they are they are affected again with a similar event, they can be re-traumatized. Now, to know, it's after the screening, because now that is when you are doing the service delivery. So you will have to talk, the screening tool, to take questions, questionnaire, and then even physical examination. All that is done by people who are trained from. Okay, what we are giving here is just basic. But when you come now to the actual service delivery, how you do it, like if you're a doctor, there's a way you should be able to communicate with his patients, so you're trained on communication skills, history taking, how to take history of these patients, and how to do physical examination. Because even touching alone would be a problem. Would be traumatizing, because this person might have been exposed to sexual violence. Now you want to examine them by touching a woman and you want to touch her, it would be traumatizing. So this, you have to be trained on how to do it. And then from the history, you'll be able to know when they were affected. And you can know whether this is acute or this is chronic. But of course, like the questionnaire we did with you, if a person said, yeah, in the past when I was young, I got this and I got this, then you know that is adverse childhood. Then they will tell you also if there have been, these memories have been coming throughout their life, then you know it's been carried, re-traumatizing. And you ask them when they think about this thing, these painful memories, are they affected? Does it affect them? If they don't feel bad anymore, it means they are coped. But if they are affected easily, these are not coped. They need support. So we'll now go into classroom strategies. Classroom strategies for an informed, trauma-informed teaching. What you need to have basic skills as a teacher to, or administrator or social worker to be able to deliver trauma-informed care. So one is you need to be a consistent caring teacher, okay, or a social worker. Consistent caring teacher, social worker. What does it mean to be very consistent care? You need to be able to manage many issues. Some of these children have issues. And you need to be able to dig deep into them to understand what issues they are going through meaningfully, and you will not finish it in one session. So take bit by bit. If they have given you this information today, affirm them and continue until you get to know what are the issues and what they do. Sometimes they have answers. They have answers that can solve the problem, but they will not speak it. It's your role to be able to ask them to speak about these things. Number two, emotional learning. So while you are doing the academic things or whatever you are teaching them, you need to master their emotions, and the only way they can be able to learn and adapt emotionally is by you as a social worker being a dependable person, a loving person. Too much. Being a dependable person or a loving person. And once that happens, definitely they will come to you. They will come to you. Positive discipline, we already talked about these things. They need discipline, but it is done well in a positive way, because that helps them. If they are destructive, they are violent or whatever, you don't need to just say, no, it's fine. No. They need to know what they are doing is not good, but it should be done. They should be effective affirmations. Like we said, in the classroom or when you are doing your social work, you need to affirm them. You need to be able to appreciate whatever they're able to do. If a student has given a good answer, sometimes we are abusive as teachers, even in the class. Somebody has said a wrong answer, and then you say something. Where were you taught? Where are you coming from? But it could be even worse than that. And then somebody feels so big, so inferior. And there are teachers, even some students will just keep quiet even when they know the answer, because sometimes they're not so sure what you would tell them. But when a student says something, you should be able to compliment and say, yeah, very good. Let them feel good about what they're doing, positively affirm them. If it's the wrong answer, there's a way you say it as a teacher. Non-violent communications, real listening. So whatever message you're giving, it should not be sending, you should not be sending out violent, what we call emotional violence. Like you are sending messages that will torture this person's mind, even if it's not physical confrontation, but you are abusive, no. And then you need to be truly a good listener in your communication, even when they are giving answers, even when they are sharing problems. Show to them that you are listening. And if a person is listening, they will know. You double check. You double check with the conversation. Keep an eye contact and listen to them. When the person has finished, give enough time to talk what they are talking about, and they will know at the end of that conversation you have been listening. And you need to promote trust building. They need to trust you by giving full, clear, and accurate information. There should be no confusion. You say this today, tomorrow is a different thing. Then you say this to a different student and something come and say a different thing to another. Then when they come to discover this, they don't trust you. And we said earlier on, if a caregiver, and we have a caregiver, or a teacher is not trusted, it becomes bad. If anything happens and they come to you, they will come to you. But if they cannot come to you as a social worker, and I'm saying this because these things we're going to teach to social workers. If they cannot come to you, it means they don't trust you. And when I'm doing my work, because we have an organization which is supported by UNICEF SIMA, and the executive director. I visit field locations. We have women girl-friendly space centers. We have child-friendly spaces, and we have people who work with children in those centers. When I am monitoring the work, the only thing I do, I ask children. I don't ask the facilitator when I'm doing my monitoring. I ask children, I ask women, I ask girls about that person. And I can ask when the person is not around. Of course. Yeah, of course. If they give you a good recommendation, then I know you are doing good work. If they don't give you a good recommendation, that's the end of monitoring. I will not ask you a lot of other things. Why is this not here? Oh, no. When the people are satisfied with your work, they will tell you. They will say. So the same thing, they need to build trust. I mean, you need to build trust so that they can come to you for support. So that's one way you can do as a lecturer or a social worker. But then also we need to promote positive, build positive peers, meaning support students or children to help each other. Sometimes they can do that without you, but if they see the teacher or the social worker is encouraging teamwork, helping and relationship build together, then they will be happy. So it's our role to help them to be able to listen to each other. Sometimes people are giving opinions here and agitating, challenging each other. We need to help students to be able to listen to one another. Because they may not speak to you as a teacher or a social worker, but they can go and speak to their fellow students. And if you have helped the students to be able to listen to each other, that's another way of helping that person come out. Share with each other their issues, respect each other's feelings, because for you as a teacher or social worker, you have short time with them, but they have a lot of time interacting with their peers. So it's our role to encourage that this peer influence is so supportive in a way that when they are in that mix of everybody, they can feel accepted, they can feel it's a safe place, there are connections where they can be able to share their feelings, and they need to be able to learn to calm down. Sometimes among the fears, fightings come up, people scramble over issues, and then people quarrel, and so they need to know how to calm down and identify personal strengths that they can be able to use to cope. Even when there is argument and then somebody has abused you or belittle you, you need to be able to absorb this, and then being optimistic, being knowing what the value of empathy, and even being able to forgive others. So these things they need to cultivate and also learn how to channel their energy and make decisions positively, and also identify how actually to apply skills, some of these skills they have learned in their real life. So we're going for an exercise, short one. Next slide. Yeah, we're going to go for a short one, and this is the last aspect of what we're looking at: how to help students develop their plans to cope with from classroom-based learning activities for students. That's what we need to be doing, and I expect as teachers, when we're coming to train social workers, These are good practices that have been tried in many of these places. There's a project we are implementing with UNICEF support in Upper Nile. We have what we call five pillars of well-being. Some of this is what I brought here. We're already doing this thing in Malacca. There's a morning check-in. There's what we call a morning check-in. And a morning check-in is what you need to do as a social worker or even a teacher. You can do it in the classroom to see how students can be today. And we call that measuring emotional temperature using a feeling thermometer, what we call a feeling thermometer. A feeling thermometer is not a thermometer per se, but it's a strategy which you use before you start any learning, before you start anything. You ask them. As there we have phrases that have been drawn for small children, but for big ones you can ask, how do you feel today? Very good. And there can be a box which you put somewhere. You can put a box somewhere where they can write and go there. So they can write their name and maybe write how they are feeling if they don't want to share with anybody. And then they need to know, to mention why they are feeling like that, whether they need help. Okay. So you can do a check-in for 10 minutes. So people write some things they throw there before you start anything. Then you come and pick these things and then you check. Who is that and who is that person? And so while you're going to do your lessons for that day, you know who needs help. What are their issues? So that is taking emotional temperature so that you know who is feeling what and whether they need help. If it's something grievous, something happened to the child or a student last night and it's very fresh, they need immediate help. You might even need to cancel that session, but attend to this student and understand what the issue is. Okay. If there is really a center that is well planned, there could be a room where you can call that child to come in, talk one-on-one, understand what the issues are, and then be able to move on. Or refer that child to another social worker if you are 2 or 3 in the team, so that you can continue with the rest of the learning. That's emotional temperature. It's good to check how they are feeling. It's important because if you just rush before you know that, you will not know who is affected and who needs help immediately. But even what you will be doing, they will not concentrate, they will not get it. Much as you might not need to isolate, but even when you are giving your messages, you will know that there is somebody who needs that help today. And even it's going to inform how you're going to adjust your activities, your communications, to ensure purposely that that person benefits. It's able to get help from what you do. It's important. Another one is called safety conversations. It's what we call safety toolbox. Safety conversations is where we ask students or course children what makes them feel safe. What makes them feel safe or unsafe that day. This is important because they can be able to give you even opinions on what needs to be done for them to feel safe. Here we are talking about psychological safety. Sometimes it can also be physical in the environment. But psychological safety. You could be the teacher, the social worker, but even the trauma might be coming from you. Yes. The way you talk, tone of interaction.
Yeah.
Okay, the bullying, the things we're talking about, and now all the other issues you mentioned, worries from the family, issues of family, school fees, they're not able to come, attend classes, they're not able to complete assignments, they are sick. So all that in their minds, they feel uncomfortable being in that class that day until that problem is solved. The goal is not to provide or immediate solution for that problem. That's not the goal. The goal is to know that somebody is feeling unsafe and needs help. And then our role is to know and then to refer where they can be supported. Something that you can adjust, like the way you are communicating or assignments. Some children assignments pile up, they could not finish, they come late, and instead of chasing, some will not come to the class because the teacher, once others said, one tip of the hour, and then you are not there, out. Then the next day they will not come to the class. So that is safety conversation. I think that's our time, yeah?
Yeah, let's go.
All right. So there are many things we could put in that safety toolbox, but the students also do add the issue. They will tell you, and then you can sit and address them. Next. Yeah, and that should be close of our last slide. So we are going to do quick exercises about classroom-based learning coping strategy. Some things you can do in the class to check how your students are looking. One of that is what we call memory boost. I'm going to pick these objects, and then you're going to see properly. What is this? You see the object well, and then I'm going to ask you questions later. What is this? You have seen, isn't it?
Yeah.
Good. And this one? Okay. And this one? Good. This one. And this one? What else? This one?
Jeez.
Okay. All of you have been seeing these things, isn't it?
Yeah.
Okay, now let's talk. Memory boost. Let's start from anywhere. What did you see here? Key holder. Key. Key holder or key? What else was here?
Smartphone.
Smartphone. Okay.
I've seen the notebook.
You've seen a notebook. What is the color?
Black.
Okay.
Yes,
Okay, next person. ID. Next.
ID.
How does it look like?
Strip.
The color of this one.
And then the color is white.
What did you see?
All of the above.
That's how we do it, and has students anyway.
Yeah, students are like this. I've seen a key.
You have seen a key. How many keys? 3 keys.
Visitors pass.
Visitors pass.
Yeah.
Okay, what is the color?
White.
White. What did you see?
I've seen a notebook.
Notebook.
The key, the car key,
Khaki, and what else?
and holder.
Holder. Okay, we will come to the rest of the people. Can we clap for ourselves? That is short-term memory, okay?
Yeah.
See something, whether you're able to, and then you are going to do this with nobody mentioned a remote.
Yeah.
Nobody.
And then you were saying what they're about.
Remotes.
You forget everything by the
Okay, another one is finish the sentence. So finish the sentence. Now I am going to start a sentence, but it's an incomplete sentence. I want the next person to add a phrase, a statement. Then the next one, keep adding a phrase to that same sentence so that at the end it is complete. Okay?
Okay.
Let's start. I am traveling.
No.
You add
Add something.
Two.
Family.
Yes.
To US, I'm traveling to US. No. Same to US. You add on
You
that.
add on that number.
I'm traveling to US to do a mission. Yes. To do a mission. I'm traveling to US to do a mission tomorrow.
At 9 a.m.
I'm traveling to US to do a mission tomorrow at 9 a.m.
On her feeling.
On aeroplane.
At 9 a.m. on
Aeroplane.
okay by airplane.
By airplane.
With my friend.
With my friend. So I am traveling to US to do a mission tomorrow at 9 a.m. by airplane with my friend.
My friend.
Come back after 2 weeks.
Okay, with my friend, we are coming back after 2 weeks.
From there, I'll finish our seminar.
Okay, we are coming back after 2 weeks at the end of the seminar.
Then I will organize for my marriage.
Yeah.
No, the marriage ceremony.
It's coming. Yeah. They finish everything they can, and then they prepare. Yeah.
Okay, so that is it. You finish the sentence. The sentence can continue, but it should not get disconnected. It should be about the mission and what you're going to do.
This will come out of marriage.
Let's start another sentence, but for the sake of time, let's proceed. Know the name. Did we mention our names earlier?
Yes.
I know our time is over, but this is our last slide.
Yeah.
Know the name. We mentioned our names, isn't it?
Yeah.
Now we're going to do a game. And the goal of this is to network, is to know each other. Are we together?
Yes.
Okay. So I'll be starting. So I'll say concentration is the game. 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 Now, that is first statement. Then I will mention my name twice. Then I will mention the name of the other person. The one I have mentioned the name, you to do the same and mention the name of the other person. Do we know our names?
Yes.
Ah, we know.
We know all our names.
Yeah.
Very good.
I don't know.
Then you have to start from what you know.
I know Sola.
You know the names. We know the names. We don't need to repeat the names, isn't it? You can mention the name of the one you know.
Yeah.
You don't need to know all the names. Okay?
Start from your loved one.
The one that he comes into your mind.
Yes.
Easily. But then you can forget it's easy. So I'm going to do it a bit faster.
Yes.
Okay.
While seated.
Concentration is the game. Keep the ball running. I'll be saying keep the ball running. Okay. Concentration is the game. Keep the ball running. Concentration is the game. Keep the ball running. Concentration is the game. Keep the ball running. Machour, Victor. Machour, Victor. Now, if I say, who is there, Victor or?
Is there?
So if I say, Machour, Victor. Then Victor, you can.
Yeah. Your name, then the next name.
Okay.
Not my name. The name of
Someone else.
Yes.
Victor.
Yes.
Somebody.
Yes.
Yeah.
Concentration in the game, keep the ball running. Machour, Victor. Now, when you don't do that, when you fail to do it, there's a punishment.
Yeah.
Oh.
There's a punishment. So we will make you to either stand or sing
A nice song.
or dance.
Yes.
Okay, the goal here is to know our name.
Yes.
Concentration is the game, Victor. Concentration is the game, Machour, Victor. Now let's do it well.
Yeah.
Concentration is the game, keep the ball running. So I'll be doing that and do it again. Concentration is the game, keep the ball running. Machour, Victor.
Victor, that is your time.
Yeah.
Okay. Concentration is the name.
Running. Say your name.
Mention my name.
The music coming down. Mention your name.
But you did not mention my name, and then you point my.
The next
Okay, so it comes back to me.
Ah.
I unfortunately I don't remember all your names. I don't mention the ones I know.
Yeah.
Okay. Concentration is the game to the whole running. Later,
Lera, Lisa.
Gabriel. Lofa.
Dr. Saleh.
We can do that better.
Yeah.
Remember, it's good for people who don't know each other. And that you'll be able to know the same. Okay. Now the next one is communication skills and teamwork boost. Okay. And teamwork boost. There is. I have some papers here.
There are very many.
Now, where are my speakers? So what I'm going to do on this sticker, you see, charades. It's a game where I'll give you a word. I'll give a student a word, okay, and then that student will do what? Will act like you either say that word in actions or in movement, and then all of us as a class, we are going to say that word aloud.
Okay.
You get it?
Yeah.
Okay. So have you gotten the instruction?
Yeah.
So I'm going to write a word here and I give it to one person. Then you are going to stand up. Then you act. You act that word.
Okay.
You act that word. Then all of us will shout out that word by seeing the action.
Yeah. Okay.
By just seeing the action of that person. So I'll write. Do the action. Yeah, that is the word. So you act it.
You act it. Such as to see what I
will read out.
You reveal
you
your body language.
The differences between holistic approach and participatory approach in extension education is, of course, enveloping the participant in all together so that they can realize the objective of extension as being a field for teaching the farmers.
So what is the word?
Debate.
Teaching.
Gesture.
What is the word?
Debate.
Explaining.
No, the explanation, I did not get it well.
Teaching.
All of us. How many people say teaching?
Demonstration.
Well, explain.
Demonstrating.
That is excellent.
That what came out as teaching.
Yeah.
It didn't come as
debate.
Although you have seen now.
It has two different words there. Okay, like two.
But they don't say the word, but
person.
you see the person doing the activity.
No, he has to.
No.
You have to read.
I'm following. Yeah.
Okay, let's go to another activity. You stand up and demonstrate for us. You act it.
Yeah.
Act it.
Not,
Act it.
Not all.
No.
you can't talk.
Fighting.
Fighting.
Fighting it out.
That was fighting, huh? So we saw that, huh?
Yeah.
Okay.
I said, go to fight.
I know this one is very easy. Give it to this one. Only you to open it.
Open, seriously.
Pray.
Pray.
Right.
Okay. Let's see the person.
Standing.
Monitoring.
Monitoring.
Yeah, of course.
What's wrong with this?
Start.
Sir,
You want me to do what? You want me to cry? I look at how I feel. No? How can I? Oh, I can. That's how I've become such. Change my eye.
A good actor.
Happy?
Exciting, happy.
Exciting, is happy, yeah.
okay, so that's it.
Yeah.
So that is the game. So the thing is that is called challenge. So you are able to read people's feelings, okay, without speaking. You get it?
Yeah.
Connect through stories. Now this one we will not have time to tell stories.
Yes.
But what you do, you help students to be able to hear stories of one another. Maybe I can give 3 people chances to tell us their favorite meals, their favorite song, or those 2 things. Because the goal is to know the person. Who can tell us what's your favorite meal?
My favorite breakfast is chapati and janjaro.
Chapati and janjaro. Huh?
Tomato.
What about the song?
Or is it called what? Tomato?
Bulukuchu favorite is bulukuchu. How do you know that?
Oh, we know.
Huh? Your favorite meal?
Then you got all your foods.
Huh?
Fish.
Fish. Uh-huh. Who else? Are we together? Your favorite meal?
Fried fish.
Fried fish. So people love different things altogether. It's good to know what the other people love, and you help students or children to also know each other. Collaborative drawing. We have papers here. Now, what we're going to do, and we have pencils. These ones will be the last 2 activities. Time is bad. So I'm going to give each of you pencils. Here, pencils. Here, pencils. Here, pencils. These are things we just do for children. They may not make sense to us, but when you are doing it in a class of children, now I want you to start. I want you to start. Okay? Then I want you to start these sides. Because we are many. No, don't give many papers. These papers are the ones we are going to share. Or you already have. So what you do, you start drawing something because of time. So you start drawing something, and then how many are this row? So you're up to there. Maybe with a blue one in the blue, 4 people. So what will happen? You draw and give it. I'll be timing you. That's called collaborative drawing. So you draw whatever you want to draw. Listen first. You draw whatever you want to draw, but the other person needs to continue
Adding.
on your drawing.
On your drawing, yeah.
On your drawing.
You started.
Okay. So each of you need to start and give to the other person. Then it will come back to you.
We are 4 in number.
And we'll see. And we'll see. Are we getting it? It will come back to you. And we'll see whether yours has been. All of you need to have.
I think.
All of you, you are rowing the
Then
same.
you give to her, then
Are
she
we
gives
together?
you art.
This group, you are rowing the
All of
same.
you.
All of you. So each of you start, then you give. Then when you finish, you come back to the other person.
You are also
Until you receive your original.
You are also drawing.
The first one.
Yeah, each person draws.
The one I've drawn. Okay.
So what happens? You start here. You draw. Then you give to the next person. I will be timing you.
Yeah, you start.
Okay, don't start yet. Don't start yet. Even you want to. You have to. All of you have to.
You start anything. Then we come to us.
No, we are still starting together.
Okay, bring
You are not.
What you draw here, you complete.
Yeah.
You draw in a way that others can add in the same drawing.
You don't complete it.
Yeah.
You start it, yes.
Give me the instruction.
Yeah.
So you draw. I'm going to be timing only like I'll be counting 1, 2,
It
3,
is
4,
the
5.
same paper.
When it reaches
That
10, you pass over your paper. Are we together?
Malu, this is
Each of you have to have one.
You start with this.
And start going like this.
Yeah, only one.
Each of you have to have a
You
paper.
start it, then I will come.
Each of you have to have a paper. So when I say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, pass over the paper. Is it okay? Let's start. Let's start now. Draw whatever you want to draw. Then when I say 10, you pass it. Then you pick the one of your friend. You continue that what your friend has drawn. You continue that same
until you
drawing.
get your original paper.
Until you get your original
Means
paper.
this one have to go to you also.
Huh?
This one for grace, continue giving.
So here you are in a group. This action, you see, all of you are going to do.
Where is the flower mine?
We have no papers here.
Okay, there's no problem. Yeah, you take it. You just put this one.
Very safe.
This will have 4.
You don't have to.
This is the flower.
Each of you need to have.
This one is empty.
Well, that's remember then the woman.
Now,
Oh, there
you
is something.
let's start.
Start
Okay?
something.
Let's
Let me
start.
give
We're
you
going to
fresh one.
start. 1. So I will be counting. When it reaches 10, you will give it out. 1.
It goes like this.
No, only 4 people.
Okay, let's.
Is it only 4
let's
people?
do only 3 groups up to him. Okay, then you bring
The
back.
end where up to him there.
Up to him.
You
bring
finish?
back. Then all of you.
What's the letter?
finish from you up to her. Okay,
This is how
up to here.
how we start.
Then this side. Okay.
Okay.
1, 2,
You part of
3, 4,
Use it.
5, 6, 7,
Lemon has been.
8. You're not drawing. 9, 10. Pass over.
Where is mine?
Pass over to your friend.
No.
Next person. You are the last one. Pass
Where is
over
the
here.
one for flower? The
Your
flower
pass
is
over.
mine. Where is it?
Where was yours? You have given yours.
I've given.
Yeah, so you receive from her. And you, from your factory. You continue her drawings. What she started. You draw from what that person has started to draw. 1.
And who drew this one?
Within the same paper?
What is
Yes, like if she has drawn.
Are you complete drawing now?
Please.
Go.
We are.
The issue here, you have to add something. Now she has put this one. I put the stem. My others will have to put
Flower
something.
there. Flower there outside.
1, 2,
Here.
This
is my loser.
4, 5, 6, 7, 8, 9, 10. Pass.
Yes.
Now the goal here is to see whether the structure will come the same, whether we are thinking the same. 1, 2, 3, 4. People are not drawing. Where is yours?
Nothing is coming.
That's what they need. Now we don't know what
Now,
we are passing and they are not.
now, last one. Last one, and then we complete it.
Bring.
1, 2, 3, 4,
You are completing the whole world, man.
6,
Just but put only one.
Where are you? You
Mine is-
are the one from the other person.
Yeah,
Okay. Now let me turn all the papers to the original members.
Yes.
Yeah, return and then you see what the drawing has come out.
Where is mine?
Each one of you take your part.
They are out of there.
Take your
And I
original.
my original is somewhere there. Where's my original?
All for
Take the
doctor.
original.
This is your. Where's my original? The one with the. Huh?
Can I?
That's a bad inside.
Your drawing, has it made any sense?
Yeah.
Are people continue to add something?
Yeah.
Where are your drawings? Original.
My original disappeared this side.
Your original is
Disappear here. I want to disappear from your side here. I don't know where did you put it.
So that is
No, it went up to that side.
Yeah. Next slide, the slides. So that is called collaborative drawing. So the goal here is to work together. To work together and with the same thinking.
Yeah.
So you start something, the other person finishes.
Yeah.
Word definitions. That one is very easy. Now, if I say a word, okay, somebody is going to give us a meaning of that word, and then all of us will select different meanings, but then we'll be able to vote for one true meaning of that word. Okay, let me start. Compassion. So, what is the meaning of compassion? Who can tell us? Huh?
Love.
Love, huh? Another
Pity.
person. Pity, huh? Another person.
Sympathy.
Sympathy.
Empathy.
Empathy. So let's vote now. Empathy, sympathy, love, pity. There were those, eh?
Yeah.
Empathy.
So which one gives us the true meaning of compassion?
Love.
Love.
Love. How many say love? Okay. Okay. Bitterness. Bitterness. Who can tell us what is the meaning of bitterness? Another word for bitterness.
Pain.
Pain, huh? Hatred. Hatred. Sorrow.
Arrogant.
Huh?
Arrogant.
Arrogant.
Aggressive.
Aggressive.
Tension.
Tension. Okay. So now we have tension, aggression. So can we vote? Which one is the true meaning? Is it tension, aggression, hatred?
Hatred. Bitter.
Hatred. What else did we say?
Arrogance.
Arrogance. So how many says hatred? Another word for bitterness. Bitterness.
Painful.
And
I said painful.
we are adding to the list. Painful.
Oh, painful was there.
Okay.
Painful.
So how many say painful is there another word for bitterness?
Yeah,
How many say arrogance? How many say hatred? So that is, so we do these word definitions to be able to help students or children to make meaning in terms of what we are doing. And that is called teamwork. Is there any other slides?
No.
Thank you very much. So that's the end of our session. We have stretched it a bit. So we started a bit late. But thank you for being active. I don't know whether you are concerned, but I will give the ball back to Tola. Thank you.
Thank you very much.